Coronary heart disease is the #1 cause of death and disability in the U.S. Cardiovascular disease in general includes strokes, heart attack, and peripheral vascular disease. Medical West cardiologist Dr. William Famba says that chest pain is the most common cause for concern.
Well, most of the time, we get patients that say, well, I'm having chest pain. Is it coming from my heart or is it coming from somewhere else? I tell everybody to take chest pain seriously.
Sometimes the pain can radiate into your arms and into your jaw, and sometimes patients can feel nauseated, short of breath, and dizzy.
But it's also important to know what risk factors people have, because somebody who is older, 70 years old, presenting with chest pain, we treat them very differently from somebody who's 20 years old. Somebody that is diabetic, somebody that has hypertension.
Dr. Famba says it's important to know your average blood pressure, your cholesterol, your family history, and he also says it's important to stop smoking.
But you'll be amazed how many patients walk around, or people just walk around with high cholesterol and have no idea that cholesterol is high. So we always try to encourage those. Exercise and weight loss, of course, is something that we always emphasize every single clinic visit.
Medical West cardiologist Dr. Raymond Workman says that many people already have blockages and don't even know it.
Usually about the age of 55 for most men, almost everyone's going to have major blockages, and for women 65, but earlier in life if you have more of those risk factors. And so it's important, even if you're in your 30s and 40s, as you said, to know your cholesterol values. If it's elevated, then make some changes.
There are 3 ways to test for heart problems. If the patient is at a high risk for having blockages, doctors might decide to go straight to a catheterization or an arteriogram.
And that's going inside the wrist artery or a leg artery. And so lower risk patients, we might decide to have them walk on a treadmill and see, can we reproduce their chest pain? Do they have heartbeat irregularities? What happens to the blood pressure?
Doctors will also use sonograms to watch and listen to people with valve disorders, where there might be a heart murmur. If a blockage is 70% or greater, there are 3 different treatment options: medicines, stents, and bypass surgery.
Now, bypass surgery is the most invasive one there, so we would tend to use that only in patients that have blockages in all 3 of the arteries that aren't amenable to stenting.
If you are concerned about your heart health, visit the doctors at Medical West Hospital for an exam. For more information on heart disease, visit medicalwesthospital.org. And if you're having chest pains, don't ignore it. Visit your closest emergency room without delay. In Bessemer, Lillian Lalo, CBS 42 Living Local.